Thank you for joining today's Deloitte webinar entitled Virtual CFO Forum, Key Considerations for the Next Normal. This presentation is being recorded. On the bottom of your toolbar is the Q&A tool. You can enter a question for our panelists at any time by typing your question into the Q&A box and clicking send. Remember that you must vote in at least 3 of today's poll questions and watch for at least 50 minutes to receive 1 CPE credit. CPE credits are only available for live participation for clients only. If you experience any issues during this webinar with polling, please submit your questions into the Q&A tool located on your toolbar. Now, please welcome your host for today's webinar, Columbus Managing Partner and Deloitte CFO Forum's leader, John McEwen. John, you may begin.
Great, thank you very much. Welcome to our virtual CFO Forum. Key considerations for the next normal. Thank you for joining. I hope you're all doing well, both physically and mentally, and are safe in these times. Again, I'm John McEwen, and I lead the Deloitte CFO Forums, which is just one part of our overall global CFO program. In the old normal, our CFO forums were held in person in cities across the globe with CFOs to discuss important issues of the day that are facing you. And we always had this great open dialogue with great peer-to-peer networking. Well, we want to try to do that today in our virtual format. We want to cover really what is topical for you today. And we also want to share our thoughts amongst each other. And we have a couple different ways to do that with polling and Q&A. So all of us CFOs right now, we're at various levels of assessing what this all means to us. What does it mean to our companies? And how do we make this next normal a better normal? So our agenda is based on what we're seeing, taking care of our people and moving forward in a new environment. So we're going to start with the medical and security key considerations, and then move into our views on the 6 imperatives that the CFOs are facing at this time. So you can see on the screen, we have Dr. Abrams, who's our Managing Director in the strategy practice, and he's our Chief Medical Officer. And Ken is an anesthesiologist by trade with 30 years in experience in practicing physician in academic medical centers and integrated delivery systems. And he's a physician leader and a thought leader in clinical strategy, quality and safety, performance improvement, and clinical integration. Ted Almay is our Chief Security Officer. Ted is responsible for a lot of things: physical security, business continuity, disaster, pandemic planning, etc. He's sort of on point. We have 80 offices and 100,000 people, and so a lot of considerations, a lot of interesting things that Ted will be able to bring, as well as being our workplace experience leader. As with all of our CFO forums, this is your forum. It's important, what is important to you? What do you want to talk about? What do you want to hear about? So we have a couple different ways to do that today, and that's with polling, which let's go ahead and pull up the first one to get started. And so you can go ahead and answer this one here. And some of these are for CPE credit, but some of these are help guide our conversations and also guide us as we think about what you're going to do in your local forums, if you participate in that, and as we expand on our series here nationally to make sure, and globally, to make sure we're covering the topics that are most important to you. I would also remind you the Q&A feature down at the bottom, I think we kicked at the beginning when we kicked this off, that's going to be really important for us and for you to be able to comment, share ideas, ask questions. You can click anonymous if you like. So Are we having any results? Okay, so you can see it's pretty spread out towards 21, with over 56% are saying that you're not going to be to a pre-crisis or near normal level of operations until 21, and that's helpful to see. I think we're all feeling that this may go on for a little bit longer. And again, how do we make the next normal a better normal? So without further ado, let's move forward with Dr. Abrams. Please get us started and level set us on where we're at. Ken?
Great, thanks very much, John. I appreciate the invitation to join this group. Obviously, getting the opportunity to talk to a group of CFOs is indeed a great pleasure, and I welcome the chance to share some information with all of you around where we stand in terms of the medical status. I will go through, some basics and also some progressive activities that are going on in the market. And what we're seeing in terms of the clinical implications and ideas that are necessary to think about as we begin to move towards hopefully a recovery phase in an organized and coordinated way, and what some of those modalities are that are going to be necessary to accomplish safe return to work for all of us. So Kathy, if you'd move on to the next slide for me, please. I just want to start by level setting a little bit as to where we are relative to the pandemic. And these data are just a couple of days old, as we needed to move them through our organization approval processes. So they're just a couple of days dated, but not too far out of date and not too different from where things are today. As you can see on the left-hand side, daily confirmed new cases, that's a 5-day moving average. You can see a little bit of a sawtooth pattern that's emerging at the top. There is some evidence of decline, but more than anything, a bit of flattening of cases. And then just towards the tail end, you can actually see that there are, some resurgence of cases that are taking place across the country. That's continuing today, and we're continuing to see new cases continue to evolve as things can begin to open, and just more and more activity is going to continue to generate that. Obviously, keeping it at a level that's going to be manageable for the healthcare system has really been one of the major goals of all of the stay-at-home efforts and the social distancing efforts that have been underway for the past several months. So if I can have the next slide, Kathy. Thank you. A few things I just want to remind people of, and there's been less focus on some of these components over the past several weeks, but these are some of the basic elements that are really important to continue to remind people of, particularly as you think about reopening and starting to try to return businesses towards more normal activities. First and foremost is the fact that it is a respiratory droplet disseminated infection that we are dealing with. So the importance of having good personal hygiene in terms of managing coughs and sneezes and the like is of course extremely important, as are things like hand washing and with soap and water on an ongoing basis. Secondly, we know that the virus can linger. It can linger in the air as airborne droplets, and those can linger for up to 3 hours as a viable virus, right? Which is important as we think about coming in closer contact with other people if we're returning to office and business more as usual. But it can also adhere to surfaces, hard surfaces, in particular. So making sure that, we're careful about decontaminating and disinfecting surfaces is a really important component to going back to work as we're thinking about opening offices. And then finally, the importance of it being a person-to-person spread, not the least of which is the fact that people can be spreading virus and transmitting virus to others, even if they themselves are not ill, which is a pretty unique characteristic of this novel coronavirus that we're talking about. Next slide, please, Kathy. So a couple of things, just to, again, as reminders to minimize exposure. Soap and water still the best. In the absence of soap and water, it would be hand sanitizer with at least 60% alcohol. Bleach is not really the most effective agent, right, for treating this particular virus. Secondly, social distancing recommendations, obviously important. Everybody's seen the news of various levels of adherence to social distancing or lack of adherence to social distancing. But it is absolutely an important modality to try and continue to reduce the spread of the virus. I talked about hand hygiene and covering your nose and mouth as well. Most importantly is to try to avoid touching your eyes, your mouth, your face, which is something that's really, really hard for most of us to do, myself included. So it's a constant reminder to try to avoid doing that as you move forward. Cleaning and disinfection I talked about, and of course staying at home if people are sick. Next slide, Kathy. So let's move on to some of the more clinically focused elements of this. And this is one that is getting a lot of play right now. I want to talk a little bit about the difference in testing that's out there. I'm not going to cover everything that's on all of these slides, but there's a few important points that I'm hoping to impart to everyone this afternoon. First, on the diagnostic testing side, what's known as PCR, polymerase chain reaction test, tests for the actual virus material. This tests for individuals who are actually sick. And I'll show you a time horizon for when that period tends to occur and when we're likely to see the results of those tests. Importantly, as good as the tests are, they do have a false negative rate that's running upwards of 30%. Right, so that could be somebody who is actually sick with a disease, but the test says they're not. Right, and those are important considerations as we think about the use of testing in a return to work scenario. Right, and we know that there are a number of countries in particular that have taken some of these tests, and unfortunately, because of lack of reliability of them, have actually had to stop using them and return them back to their manufacturer. So certainly something to be aware of. There are a lot of tests under development on both the diagnostic side and the antibody side of this equation. Again, I'm not going to go through all of those that are under development. There are some here. There continues to be progress being made, but we have a significant limitation in the availability of tests in the United States right now, which does pose a challenge as we think about utilizing testing as a way of being able to help get people back to work in their normal activities. On the antibody side, that is the test that actually says that somebody has had the infection and hopefully have developed immunity to the infection and therefore would not be at risk for being reinfected. We don't actually know whether or not that is true today because we just don't have enough data and information to know exactly how long the antibodies last and exactly how much antibody presence is required in order to ensure ongoing immunity. All right, so a number of tests here. getting released, more being developed by the manufacturers, and that is continuing to grow and develop. There was a question that came through. John, if you don't mind, I'm going to pause to see what this question was.
No, I was going to ask you, it came through about when you look at the country, that the hotspot in New York City was so, the results there were so dramatic that if you pull the New York data out, what does the rest of the country look like? Is it still increasing?
The answer is yes. The rest of the country is still increasing. Those data that I showed you previously were already with New York on a decline. All right, so they had already begun to not only flatten the curve, but also reduce the number of infections that were taking place. So we are absolutely seeing other parts of the country, particularly areas that are opening up, and a number of hotspots emerging. Right, we've heard about some of the hotspots coming out of some of the food plants, where workers have been cross-contaminating each other, getting ill. Those are continuing to drive the numbers, and as things are opening, we are seeing some areas of growth in other parts of the country as well. Okay. So if we continue just to look at the use of the antibody tests, I'll go into a little bit more detail around how the tests are used and what some of the information imparts to all of us. So Kathy, if you can move to the next slide, please. A couple of key concepts that I just want to get across to folks. One is the timing of serologic testing is important in being able to detect antibodies. I'll show you that timeline in just a moment. The antibody that helps sustain immunity is known as IgG, immunoglobulin G. That is the important antibody for maintenance of immunity. I am going to talk about sensitivity and specificity and prevalence, which are three very important variables. And I'm actually going to use an illustration to show you against a cohort of 1,000 individuals and how these concepts apply. But simply put, sensitivity is the portion of patients with the disease who actually test positive. All right, so that is if a test takes place, all right, and I get tested and I come back as a positive test, and that shows that I actually have the disease. There's a proportion of those individuals, because there's some of them, as I mentioned, who actually test negative even if they might have the disease as well. Specificity is just the opposite of that. It's the proportion of patients without disease who do test negative. And then prevalence is the proportion of the population who actually meet a certain criteria and definition for having the disease at a specific point in time. So if we look at the New York example, the prevalence in New York is estimated to be probably around 5 to 7% right now, whereas the prevalence of the disease in the vast majority of the rest of the country is estimated to be between 1 and 2% right now. So a significantly greater number of people who have actually had the condition in New York, therefore the higher degree of prevalence. Okay. Kathy, next slide, please. This is that time horizon graph that I want to help you understand. There's a period of contagiousness, which you can see by that gray box that takes place from the time in which somebody is exposed onto about 5 to 7 days of contagious transmission, when you can confer the illness onto another individual. From there, we start to develop immunity, right? And that immunity takes place with 2 different antibodies being developed. It's not important, the differences between the antibodies for the purposes of this conversation, except to say that IgM is short-lived. It appears earlier and resolves itself much earlier as well, and does not sustain its presence. But it's immunoglobulin G, the IgG, that sustains immunity for individuals, and hopefully onward for significant periods of time. But until we have more information, we won't know exactly how long that will sustain itself. Also, as everybody knows, this particular virus, people can transmit the illness without themselves being ill, right? Or at least not aware of themselves being ill because they don't feel ill, right? And don't have signs and symptoms of illness. So next slide, please. This is the samples that I wanted to share with you. And this, I think, is important, particularly for this group as you think about opening your businesses. This is the sensitivity and specificity around serologic testing. And I've got 3 different scenarios here. The first scenario on the left-hand side assumes a 1% prevalence, roughly what we think the vast majority of the United States has today. And then the middle scenario has a 10% prevalence across the community, right, where we're starting to see some examples of higher degrees of penetration, in the United States, particularly in New York, as I mentioned, parts of California, but also other parts of the world. And then the third scenario has a 70% prevalence. And that's where we would like to ultimately get to, where we have that degree of prevalence in the community, because that's going to give us the strongest likelihood of having immunity, so-called herd immunity, as you've heard referred to in the media. So why is all this important? I kept the sample size the same at 1,000 people, and I kept the sensitivity and specificity the same at about 90%, which is the average of all the serologic tests that are currently available. What changes here is at the very bottom of this slide on each of the scenarios. And that is, there are going to be individuals in the 1% prevalence scenario. There will be 99 people, based upon the science and math associated with this, for whom we believe would be immune because they've tested positive for the presence of antibodies. But in fact, they actually are not immune because of the limitations of the test and the testing modalities that are used. All right. As we move to a higher degree of prevalence, if I jump to the 70% scenario, you can see we go from almost 100 people in the 1% prevalence scenario up down to 30 people in the 70% prevalence scenario. So we have a much smaller number of people who are in this category of perceived immunity, but actually remaining susceptible. So there's always going to be a small percentage of people, and that percentage actually continues to go down as prevalence goes up and sensitivity and specificity goes up, which is one reason why the FDA is so focused on understanding what the prevalence, what the sensitivity and specificity for these testing modalities are by each of the manufacturers that are bringing these to market. Now, one other question came through around the concept of virus mutating. And you've probably seen some reports around the fact that there is growing evidence that the virus has already mutated from the point in which it had begun in China, and then moved over to Europe, and then ultimately came from Europe here to the United States. So we already have seen examples of and evidence of mutation beginning to take place. And that's pretty typical for a number of viruses, including coronavirus, but very common, of course, for influenza virus, when everybody knows we come out with a new vaccine every year for influenza based on what we believe the mutation changes are likely to be. So let me move on to the next slide and talk a little bit about some emerging benefits that are starting to take place. So this is on the drug side, and then I'll talk a little bit about vaccines. Right, we're starting to see some benefit in 2 particular categories of medications that are being used. Probably most noteworthy is remdesivir. just last week, there was some early information released from the US controlled trial that was done. It was released by the NIH that has actually demonstrated improved recovery time with the use of remdesivir when compared to a non-drug placebo. There's also some evidence that remdesivir helped reduce mortality, but that still requires further investigation. So we'll get some more information sometime around the middle of the month as the rest of the data becomes available from the study. It was only the preliminary information that was revealed to date. And then there have been some reports just recently that remdesivir in a 5-day administration, as opposed to 10, which has been the standard therapy of administration time, is actually being shown to be equally effective to the 10-day administration, which would be really good news because it would double the amount of medication that would be available that the manufacturer already has to share. Secondly, I just want to highlight convalescent plasma. This is taken from individuals who have been ill and is a very useful therapy for treating people with severe COVID disease, and it has shown to improve outcomes. So hopefully we'll see some more there. Obviously, a lot of development taking place in and around the life sciences marketplace to continue to develop more and more medications that'll be useful for treatment. But in the absence of treatment, right, we're still struggling a fair bit to be able to take care of these people. And next slide, please, Kathy. And then finally, vaccine development. So there are eight vaccines currently under development at this point. There are well over 100 right now. That number is out of date at 94. It's surpassed to 100 that are continuing to undergo evaluation. The key piece here is vaccine development has been accelerated significantly in an effort to try and combat the virus and the pandemic. It is still going to take a significant amount of time, however, right, before we have a vaccine available to us. So I think we're still looking under the best case scenario, somewhere around 18 months to have a vaccine readily available. And then of course, manufacturing would be key. Next slide, please. Just two last points that I'd like to make here. One on temperature monitoring. This is a modality that's likely to be used by almost everybody that's going to reopen and bring people back to work. There are limitations, however, associated with it. Not everybody's going to show a fever if they're infected, and there are lots of other reasons why people do get fever over the course of their lives and everyday physiologic changes. And I think the next slide's the last one, Kathy, if I'm not mistaken. And that is the role of face masks. And I think really the important message here is twofold. One, CDC is recommending that people wear non-medical grade cloth face masks whenever they're in public. Keep in mind that is to prevent the individual wearing the face mask from transmitting illness to others and just reduce the likelihood of that spread. It is not protective for the people who are wearing the face mask against other people who may be transmitting the virus. There are obviously many more types of face masks and advanced respirators available for greater degrees of protection. Those are recommended for healthcare personnel and frontline workers at this point. So John, I think I'm going to hand it back to you.
Thank you. A lot to think about there, Ken, and some other questions, and I have some as well about, as you can imagine, opening back up people over the age of 65 that maybe don't have other issues over the age of 60. What is their likelihood of succumbing to this? So there's some questions there we'll get to. But keeping the conversation going is like trying to use some information, and we'll talk about some of those when we get to Q&A. So do we have a second polling slide here? And we do, I know we do, and here it is. So, you know, one of the things that's making this, and you can read the question there, that's making this interesting, and you know, most of you have, you know, operations all over the place, manufacturing, you're at different stages, depends whether you're in office or not. On top of that, you've got all the different state requirements and local requirements. So this is, as you know, not simple to make a broad-based recommendation around how to do things. So I'm seeing all types of various plans of, you know, people shutting things down and not planning on coming back anytime soon. Some are doing it in waves. Those of you that want to comment, or it's a little bit harder to do over the Q&A, or if you have questions or comments around there, please go ahead and enter that in there, and we can cover that. So how do we look here? I think we'll probably get the answer here pretty. So it's pretty spread between the opening up as soon as you can and those that won't. I would say, you know, that's interesting. If I'm reading this correctly, we have 37% that disagree or strongly disagree, and you know, 46% that agree or strongly agree. So not terribly. Obviously, people that are the agrees and strongly agrees went out there, but there's still with 16% in the neutral, quite a variation among the respondents. Okay, well, let's move on. I think using some of that medical stuff and then say, okay, what does this all mean? Let's talk a lot about, as you think about and considering some of these things, what are the key considerations for you? So Ted, if you would take it from here, appreciate it.
Sure, John, thank you, and good afternoon, everybody. I really appreciate the opportunity. Kathy, if you could move us forward here, please. So we wanted to show you, this is an internal slide from Deloitte of what has happened to our firm since the pandemic, to give you an idea of the global reach. So as you can see, the red areas are where we are required to work from home or work remotely. The tan areas are where you are encouraged, and we've got over 95% of our folks there working remotely as well. And then white is where we have no presence, and the little bit of blue where there's no specific change to the work from home strategy. That's fine. You can move forward again. So as we get ready to come back to work, we've established a global PMO office back the first week in March, and it has dozens of work streams spread out, all for how we're dealing with the pandemic now within our company, as well as how we're helping our clients move forward. So I wanted to break it down a little bit and talk about reopening and some of what those considerations would be going from a virtual environment to a physical return to premise or coming back into the office. We have broken this down into 4 primary areas in our work stream, which is getting to work, what type of screenings we're going to do or not do, what happens when you are at work, and then what happens when you prepare to leave work. So those all 4 work streams are coming together, working very hard to get us ready to reopen to one degree or another. But we also believe that the biggest challenge we're going to face across the board is going to be social distancing. For most of us at Deloitte that are at client sites during the day and that as you can imagine, runs the gamut from high-rise office towers to manufacturing sites to mines to agricultural centers. Social distancing will really be a challenge, and primarily because it's got a ripple effect clear across the enterprise, but nothing we have is actually designed for it. So when you think about 6 feet of space around you, you think of things like transportation, whether that is subways or buses or cars. When you think about things like elevators, and I'll come back to that in just a minute, our conference rooms, lunch rooms, break areas, and particularly our restroom facilities are going to really pose challenges for the 6 feet social distancing. So getting into work, just the idea of coming back into an office center, we've listed out here external prerequisites and considerations. Obviously, government restrictions have to be lifted, but beyond that, things like schools and daycare being open, public transportation working, being able to move people to the office, and then the challenge itself of the lobby and primarily elevators. So for social distancing in elevators, in our conversations with multiple landlords and tenant agencies, we're all looking basically at the same scenario of being able to put 4 people in an elevator in the 4 corners, facing away from each other, and then going up to the designated floors, not stopping in between. So if you're on the 12th floor and you're trying to get to the 20th floor, the elevators are not going to stop. So it's going to pose an internal problem being able to move around, because you can't stop on 12 with 4 people in the elevator and take on more passengers. So elevator comes up, you come off the elevator. Most of our high-rise multi-tenant buildings are telling us to expect somewhere between 90 minutes to 2.5 hours to be able to get from the lobby up onto the floors. When you think about the lobbies of high-rise buildings and social distancing again, that's going to space people, perhaps hundreds of people, out onto the street, onto the sidewalk, waiting their turn in queue to get up into the elevators. And obviously, that's just not going to be a workable solution for most of us. So once you come off the elevator, assuming that you get that far, then you look at what type of screening are we going to do. So Dr. Abrams talked about testing, whether that is antibody testing or testing for the virus itself. Hopefully those will progress at a rapid level, but right now, neither one of them are really much of a viable option for large groups of people at this stage. Hopefully they'll be there soon. Dr. Abrams also mentioned temperature screening. So do you do that? Should you do that? How would you do that? How are people going to queue up to do that? Is it going to be a contactless gun that shoots to the forehead to try to get a temperature? Or are you going to do some type of thermal imaging and then pull people out that have a temperature above a certain degree, or a self-declaration where people say either on a screen or a computer or on their phone that you are not sick, you haven't been sick, you haven't been around people who have been sick, and then self-declare that you are well enough to come into the office. If you get through all that and you actually get into the office space, then what does that look like? So again, social distancing around desks, around work areas, around benching, workflow, how are you physically going to move around the office, arrows on the floors to direct traffic so people aren't colliding with each other, and then any type of personal protection equipment. Are you going to issue masks, require masks be worn, face shields, gloves? What type of equipment are you going to recommend or provide or require once you're in? And then leaving work then focuses back again on the same issue. How are you going to get out of the office? So if you had to wait, say, an hour on the queue on the sidewalk to get to an elevator, you obviously cannot queue up in the elevator vestibule in the building. So you're going to have to space back out into the workspace. it could take another hour or longer to get down out of the building and back to whatever transportation mode you're going to have. And then what do you do with the personal protective equipment that you had? Are you going to collect gloves? Are you collecting masks? Are you going to let people take masks home? Let them, if they're washable, let them take care of them. Face shields, that whatever type of equipment you've issued, gathering that up when they leave. And then it begs the question of then who comes into an office? Are you going to invite certain employees back in? Are you going to tell others to wait? They shouldn't come back in. What are you going to do about visitors, contractors, and vendors? Are you going to have special requirements for them, or are they to just stay away for the time being? Some obviously vendors you have to have in, particularly like cleaning crews, who will be critical at this time as we go through the building and getting it ready to reopen, as well as the end of every day or every shift, cleaning those areas and what type of cleaning they're going to do. Next slide, Kathy, if you could. So we've set up for us a sample timeline of what that looks like from the assessment that we're going to get ready to reopen until we actually open our office and invite people back in. So for us, it looks somewhere between 2 to 4 weeks of thought process, planning, and going through what all steps we need to take. We've outlined those here for your consideration as well to take a look at. And then the other key factor with all of this, of course, is then contact tracing, what we're going to do or not do about contact tracing for employees that show symptoms or become ill, and being able to notify other employees that they may have had contact. There, as you have seen, lots and lots of apps in the market space, lots of, some of them work, some of them don't work, some of them only work in connection with each other. And so there are lots of challenges around contact tracing and what you are planning to do or not do for your own staff. And then what do you do outside of work? So if a person stops at Starbucks on the way in, do you have a requirement, or are you going to notify Starbucks that they may have had contact with an infected employee, or just defer that hopefully to the public health department to let them do those contacts? But you still have your own employees, your own contractors, your own vendors who may have had contact with a different person. Okay, so with that, John, that is kind of the highlights of what we're thinking about from a reopening standpoint and different struggles that we're facing. But right now, John, the issue for us is elevators are going to be our Achilles heel in these high-rise buildings.
Well, there's certainly a lot of things to think about, and I know many companies have put their toe in the water, announced their plans, have thought about coming back in waves. Many manufacturers and others are already doing a lot of these protocols in their manufacturing facilities. I think thinking of like cities where you have a lot of high rises are just really going to be problematic for us to go back. I think one important point is I think many companies are certainly from a physical perspective pleasantly surprised at their ability to work from home, and many have said that after this is over, we won't have 100% of our people come back to the office. We are really going to rethink our footprint, how we do things, and it's not going to be wholesale, but really going to think about how this changes the workforce going forward. As the CFOs are all in the process of modeling that, what's that look like? How do we think about that? I know some companies just I think that's going to be the exercise that we're all undertaking right now to figure out how we're going to do that. And it seems to change week to week based upon the number of cases and how this works. So I know from Ted, go ahead.
No, I was going to say, John, one of the things that has been very helpful for us, as you know, is we at Deloitte, as an example, we've been a virtual workforce for decades. our travel, our people in and out of our offices and in and out of client sites. And we've never actually, from our standpoint, totally shut down any office. We still have a few people coming in day to day, doing things in the offices and maintaining the office space. So the idea of reopening and bringing people back will certainly pose some challenges to us. But obviously travel for us at Deloitte US, we averaged 28,000 people a day in the air back in November and December. So for us, not traveling has really been the hardest part of this so far. And of course, there can do a whole nother section on what travel may or may not look like in the coming months as we get ready for that type of reopening. But for us, being virtual, our networks are set up. You know, it's been relatively easier, I think, than some companies where you have a high presence in a facility or a manufacturing type facility, retail certainly, that's going to pose a lot of challenges.
Any other Q&A right off the top here? It could be a whole topic, and we'll talk about more about how we interact with the group and breakouts and coming up on your local forums or our next national one as well to get your feedback. All right, well, let's go ahead. I think many of you hopefully have seen through the CFO program an article or document, a thought piece that Ajit Kambil put together around the 6 imperatives for the CFOs. And I think it's a great piece, and I think it's very helpful for us to sort of run through this and think about making sure that we're addressing all these points. So I want to invite Ajit to talk a little bit about our imperatives and the research that he's done around this.
Yeah.
Ajit?
Thank you, John. Do we have a polling question first as we start this? So we'd like to know what you perceive your workforce is likely to be within a year from now.
And this is the overall size of the workforce.
That's right.
What maybe a later topic is, will they ever come back to the office?
Exactly. So can we get the results? So within 10% of the current level, that's actually very encouraging, actually, given as the dominant response. So let me share with you, the 6 imperatives that we see for CFOs. You know, as we worked through the last recession, we really looked at all the prior recessions and how CFOs navigated those recessions, what successful companies did. And we generated 5 key imperatives that are also vital to this recession. But the 6th one is what we're all experiencing, where we've all had to virtualize almost instantaneously. So if we go to the next slide. So, you know, the first one is really what we've all done in the last 8 weeks, which is, you know, take care of our people and literally virtualize our organization as best we can. And I'm going to click down on that in a little more detail in the next slide. The remaining 5 are things that most of us already know how to do and what to do, you know, in terms of bolstering liquidity, if we need to, you know, making sure we have good credit lines, drawing down revolvers, you know, managing our cash flow almost on a daily basis, communicate with our critical stakeholders differently. We've seen a number of firms, for example, already reduce the provision of guidance, given that existing models are not at the moment applicable for forecasting, drive operational improvements within finance and even outside of finance where necessary, manage critical risks. We see, for example, internal controls risks go up in these sort of situations when your staff may not be as available to monitor things, or for example, cyber attacks go up. But also what we have found in the past is that we are also vulnerable to cascading risks. An event occurs in one area, it then cascades to a bigger event in another area. For example, it might be that our credit markets may freeze up in the future if there's a cascading series of risks from bond markets that serve municipals and governments, for example. So, what are the likely cascading risks? Or, for example, you may have third parties, which are much more prevalent today in our business ecosystems. If one of them fails, you may not have critical supplies come to us in a timely way. So we have to really engage and think through what our third-party risks are in this crisis. And then the sixth category is what we have found in the past is that companies that really came out of this well did a number of things during the crisis to prepare for the post-crisis environment. Whether they identified critical companies to acquire if they had the capacity to acquire, whether they modified their products to adapt to the changing needs of their customers, and whether, I think in this case, they go even more digital than they have been in the past in terms of automating areas that they now have proven by being virtual that they can do digitally. If we go to the next slide. What I want to click down on is the one change that has been forced upon all of us through social distancing, which is the need to virtualize. And there's sort of a technical component to this, and there's a leadership set of considerations to this that we may not be as used to. From a technology perspective, one of the first things we might find is our networks are not structured adequately to handle the traffic that all of this is generating. Many of our corporate networks were centered around offices, and what is needed now is to begin thinking through how do we build software-defined networks that sort of segment different categories of traffic so that they're adaptable to changing needs. A second area of investment, and I know a couple of firms found this to be challenging, especially in their outsourced relationships, where do the employees or even your suppliers' employees that you rely on for critical information have virtual desktop interfaces so that they can access all the critical information they would normally access in their offices. So it's sort of essential to begin thinking about how do I implement virtual desktops to enable that secure access to the information I need in an office and also maintain the security of that information. A third thing that we're seeing is in order to be scalable in terms of collaborative applications, like this video conference, for example, one needs to move to cloud-based applications for communication and collaboration. And I know a lot of firms have been doing that in the last 2 months. And then after all of these three areas of investment, it's beginning to prioritize what are your most critical customer interactions, as well as internal operational applications that you have to virtualize. So there are these 4 areas I think that are critical for CFOs to really work with their CIOs in managing. And on top of that, making sure that you're continually monitoring security and managing the security of your IT systems. But the other set of considerations has to do with how do we lead in a virtual environment, and how is it different? When I do transition labs, often when I interview CEOs and I say, why did you select the CFO? They'll say, well, they're really good at looking around the corner and seeing what's coming. And our ability as CFOs to look around the corner and see what's coming, it relies on a series of relationships and often informal conversations. It relies on a refined sense of being able to read visual cues and see somebody comfortable or uncomfortable, and to pick up on signals that are really difficult to pick up on in a virtual or even in a video conferencing environment. So all of us have to begin to think about how do we lead differently in this context. And so we've been interviewing a number of people who've been studying virtual leadership. A piece came out last week from in our Wall Street Journal channel, which was an interview of Sandy Pendland at MIT. In the next 2 weeks, there'll be pieces with others, one focusing on the psychological impacts of virtualization on your teams and how to mitigate those psychological impacts, and another focusing on how to establish trust relationships and improve relationships quickly in a virtual environment. But what I want to do is just give a few tips on how to manage through this virtual environment. The first one is really be clear about the purpose of your meetings and exchanges with others in a virtual environment, and really seek other ways of getting feedback from your participants. You could ask one of your participants to take notes just to make sure that they've really heard what you wanted them to hear. Alternatively, just call one of the participants and say, what did you hear in this call? Did the message get through correctly? So check on how your messages are being perceived by others. Because one of the things that happens in this space is something that we call attribution theory. When somebody does not have full information, what they tend to do is attribute a reason to, or their models to that context. And because of that, they can misinterpret your communications and your intentions through this channel because they're not getting the typical visual cues that come in a face-to-face communication. The second thing that's important is to really foster one-on-one connections beyond your direct reports. And this can help you get a pulse on your organization. It can also help reduce the stress of your staff because they value and need that connection and feedback. The third thing is to sort of take a page from Stanley McChrystal's team of teams structure. Put people on your leadership team and secondary roles on other teams, and use those structures to foster the open sharing of information and the capture of signals at multiple levels across your organization. Because as we go virtual, one of the hard things is we do these intentional communications that are often one-on-one or a large group conversation. We're not often seeing how individual teams and smaller subgroups are actually perceiving issues. So having people distributed across the subteams can be very helpful in identifying and raising issues to you. One of the things from a mental health perspective for your teams is making sure they have someone to talk to and someone they can turn to for help on an issue. Whether it's even how to work effectively with this technology, it might be a good idea to think about how to pair people up from a buddy perspective. And then a final thing that's very interesting is people attenuate signals and appreciation in this environment. Positive feedback may be attenuated down, while negative feedback is sometimes amplified in terms of perception. So it's really important to show appreciation for your staff. And I can only imagine how the last 8 weeks have been, because all of you have had to sort of rethink your cash flow forecasts, rethink all the models that you used previously, undertake maybe a virtual close, all of these things that are very different, that have probably caused stress in your teams as they work hard. So these are a few tips, and you know, in the next 2 weeks, you'll see more on how to manage virtually. As Ken and Ted have alluded to, when we come back to the workplace, not all of us will simultaneously be in the workplace. It'll probably take at least a year based on some of the survey responses even that you have shared today for all of your work staff to be able to simultaneously be in one place. And so we're going to have to operate for quite a while in either a fully virtual environment or in a hybrid model. And as we do so, we're going to have to consider how we change our leadership and how we foster better virtual interactions. So let me stop there. I think there's another polling question that follows this, right? So if we can see the question. So in the next 12 months, will your IT tech investments for virtual and automated business operations increase, remain the same, or substantially decrease?
And I would remind everyone on the call, after you post your answer to this poll, that sort of concludes sort of the formal presentation, a little bit of this today. And then we'd like to try to get as many questions from you as possible. We've got several in the queue that we'll look at and answer for you here, but we've got some time left, so we'll find out what the answer to this polling question is, and then we'll go to our panelists and try to answer some of these questions. Do we get the results?
It'll increase, and some will remain the same. So terrific. So I have a question here, John, that popped up in the chat rooms, I think, and it says, can you tell us what you're hearing are the downsides to virtualization at this point? I think there are a couple of different downsides. One of the things about virtualization is it obliterates the boundaries between work and home, at least in this particular situation where people are working from home. And one of the virtual network providers actually did a survey, or not a survey, they looked at their own data, and they found that people were probably working 3 hours longer than they normally work, because they're not setting boundaries between their work time and their home time. And the rituals that they used to have between home time and work time have gone away, whether it's driving and listening to NPR in the car or whatever, and getting back home, those comforting rituals that you have gone away. And as a consequence, I think there's also, maybe Ken could speak to this perhaps more than I can, there's also increased stress amongst the workforce. And I think that's compounded by the nature of this situation. So I think we need to be careful about whether our folks will burn out, and how do we help them manage their time more effectively in this environment. So one of the areas where we see virtualization as a challenge.
Ken, do you want to comment on?
Yeah.
Go ahead.
Yeah, I'm happy to. And Ajit, I think you've raised a critical issue around, stress in the workplace. And there's a number of factors contributing to it, right? First of all of us are on these video calls, right, from morning till evening, and you're constantly on. As you said, there's no boundaries, there's no separation, right? How many times do we video conference straight through lunch, right, and not even take a break? So that's one piece of it. But just what's going on in the country, the humanitarian impact that is taking place everywhere, some communities more so than others, is hitting people hard. Certainly if people have, friends or relatives or close acquaintances and business colleagues that may have been affected by this. I know we've had some of that in the firm, where we've had some of our own people who have taken ill. That hits people hard, right? And it causes a tremendous amount of stress. And for this group, right, there's no getting away from the economic stress that everyone is feeling, whether it is organizational economic challenges or personal economic challenges. As changes in the stock market take place, people are losing their jobs. We've got 30 million people on unemployment now. All of those things are just very significant psychological stressors.
Yep. I want to share a conversation I had with the CFO recently about managing their loads on their workforce. So what they did was they looked at the work that they have to do in finance, and they said, these are the basic things that we have to do, and we'll make sure a portion of our workforce is dedicated to doing those basic things. These are the novel things we have to do, which is redo our forecasts and so forth. And they separated out the people working on those sort of critical, immediate novel things from the things that they had to do that were more routine, because they didn't want to mix the two of them together and create sort of greater work stress, if you like, and made sure that the people who are working on the new things actually got rid of some of the things that they previously would have to do so that they could retain their focus. And I think that is instructive of the kind of levels that we're going to have to really think about in terms of separation of tasks and activities going forward to help our workforce navigate through this effectively. Other questions coming in, John?
John, I think you're on mute.
I think that might be the most common phrase on the planet right now is that you're on mute. So I apologize for that. What are we seeing on how do you do scenario planning now? We've got so many things that are possible right now. We've got some lessons that we had from 08, 09. We had really almost sort of this first phase that we got caught with. And any thoughts around how we do scenario planning in this uncertain time?
I'm not sure there's a straightforward answer to that, John. But I do know, what our economists tend to do is look for sort of a best case, moderate case, and worst case scenario, right? And this is going to vary across every industry right now because, what is feasible in travel is going to be very different than maybe, in technology and other sectors, right? In terms of what work can be done remotely. So I think, it's almost an industry by industry scenario plan that you have to work on if you are serving multiple industries, and then determine what the market might look like. You also probably have to do scenario plans on the financial side. What is likely to occur? Is there likely to be continued deflation because we have a tremendous contraction in demand, a lot of supply, at least from a workforce side, that's becoming available? Or, are we going to get at some point to an inflationary model in a few years? And that we haven't had for 20 odd years or so, right? So, or are they currency sort of scenarios that you have to worry about based on the global distribution of your business? So I think there are going to be multiple kinds of scenarios. The different areas of your finance function will probably have to create both for themselves and the environmental context therein. I don't think there's a simple answer to it, and then you have to aggregate from that.
Great. Ken, I've got one here about what do we do if, what other types of screening is available if a temperature check is not really useful?
Well, it's not that temperature checks are not useful. Right? They are indeed useful, right? Anytime we can identify somebody who has an elevated temperature, that is going to be suggestive of something going on. Now, that something can be physiologic, such as, a routine menstrual cycle change that is, typical and recurring. But it's a sign that says we should investigate what might be going on and evaluate whether or not it is related to an infectious process. Right? So temperature is useful. Right? I don't want to give people the impression that it's not, but it's certainly not confirmatory or diagnostic of a particular disease. So it needs to be put into the context of the individual, what other exposures they might have, what stage of life they are in, other contributions that could be, other conditions, that could be leading to the potential for a fever, and there are lots of them. But in addition to that, a good screening assessment, right, for whether or not people are experiencing symptoms of any sort, or they're in a household with somebody who's experiencing symptoms like cough, right, like perhaps a spouse or a child who has a fever, right? All of those things combined, John, become part of a broader portfolio of evaluative components used to try to minimize the risk, right, that an individual who is going to be ill and contagious, right, enters the workplace. There's nothing in place right now in sufficient quantity and capability that's going to give us definitiveness about that. It's about improving the probability.
Okay. Ted, there's a lot of, part of the stress at home is, people have kids, and, how do we think about this childcare for employees? What is Deloitte thinking about in managing, childcare demands, or employees in the, returning to the workforce, or, what are people thinking about that? I don't know if we've got a view.
Absolutely, John. And as you know, within Deloitte, we have an arrangement with Bright Horizons daycare centers around the country, and we have extended credits to those employees who want to take advantage of the Bright Horizons services. I think that as daycare centers open back up and get more back into the stream, and particularly with schools, there are going to be people who really, a lot of our employees who need that that service in order to come back into the office or to come back into the workforce. And until schools and daycare centers are back on some type of schedule, it really forces us back into a virtualization model because there's just nobody left at home to take care, particularly of young children.
One of the other questions are what other opportunities are there? I mean, you know, as Churchill said, and I think a lot of people are taking advantage of this, never let a good crisis go to waste. And what are the other opportunities that we're seeing companies take on, and CFOs, opportunities for CFOs as they're coming out of this crisis?
Well, John, I think immediately as the crisis hit, many of the digital transformation initiatives that companies had in place were probably put on pause, and they focused on immediately virtualizing. But I think what's shifting here is a recognition that we will do a lot more things digitally going forward, whether it's consume various goods, services, e-commerce will continue most likely to grow. And I think a lot of companies, you know, will look at how do they position to take advantage of the shift in the marketplace.
Are there other things that we should plan? What you know, if there's a second wave of this virus, are there other things we got to think about?
I think the other thing is creating really resilient supply chains. We've created very global supply chains. There is, you know, the beginning of additive manufacturing occurring. The question is, you know, can we create a more resilient supply chain using those kinds of capabilities as we go forward?
Yeah, John, I'll tag on to what Ajit is saying. I think the supply chains have been one of the most difficult components in the marketplace to be able to navigate. Right? Particularly our healthcare clients, right, who have been trying to access high quality PPE, personal protective equipment for their staff and for their teams. It's been a very, very difficult challenge to be able to find those products manufactured to the level of certification and resilience that's necessary. So I think it really opens up a huge manufacturing opportunity in the country that is probably worth reevaluating based upon our needs.
Very good. Other questions here the panelists see? Obviously, there's a few questions here that I can tell, you know, is anyone having success with business interruption or other kind of insurance coverage assistance? I think at this point, we don't know, and for purposes of this call, I don't think we can answer that. There's some other ones around the accuracy of the data, documenting how many people have been tested positive, died, and recovered. I don't know, Dr. Abrams, if you want to comment on that, if you have a view at all on how confident you are in those numbers.
Yeah, it's, you know, I wish I had a way of answering that question legitimately, John, with some, you know, evidence and data. I think there's a couple of things that we do know. You know, there have been reports of further evaluation, some coming out of California, some coming out of New York in particular, of people who had passed away prior to when we really felt that this pandemic was emerging. And as they go back and reevaluate the cause of death, are identifying those individuals as likely having died from, you know, from the coronavirus. So I think the numbers are probably somewhat underestimated in terms of, you know, deaths, because we really don't know how far back. And then there's a number of people who are dying without ever getting to the hospital or ever getting tested. Right? So are those people who are going to contribute? But I think directionally, the numbers are pretty accurate. right? We know what the status is, how it's changing over the course of time. Testing is becoming more available, although not anywhere near what it needs to be or should be as we continue to move through this pandemic. But I think generally it's pretty good.
Very good. Maybe one more question, and then what I've learned through these sessions is it's always great to end one of these Zoom meetings about 5 minutes early, just because I think everybody needs a bio break, and I think it's approaching cocktail hour at least on the East Coast. So while we're not all together at our typical CFO forums and we'll toast a drink, we'll try to wrap up here a couple minutes early. So why don't we jump to our last polling question, and I think this one will help guide us as we, this was sort of our first one. As we think about going forward, what we might want to do is have a speaker, and then with Zoom we could break out into either local CFO forums or by industry. We're thinking about both of those, but in any case, we want to get your feedback on what topics are most important for you. So please take a look at this last polling question. And certainly, as we're doing this, if there are other items that you believe that you'd like to hear about or you'd like to have us discuss, don't hesitate to reach out to our CFO program website, which I think many of you are familiar with, and we'll be able to grab that together. But I think this has been a good start. Can we see? Well, this is excellent feedback. Thank you all. It's not unlike what I see in a lot of cases of depending upon where you're at and what industry and what size company and a lot of things. The workforce transformation, economic outlook, and really the strategy for thriving. I think what I've seen and what a lot of others have seen, and Ajit, you could comment on this as well, is that companies are figuring out what's changed, what's going to stick, what do we really need to think about differently going forward as a result of this, because it is going to be a next normal and hopefully a better normal for all of our companies as we come out of this. What is the best that we can take out? So terrific feedback. We will take these questions and use them for our knowledge base to address our next session. And I want to thank all of you for joining us for our CFO Forum, and the first one in a virtual session as we all prepare to make the next normal a better normal. So I want to thank the panelists, Ted Almay and Dr. Abrams and Ajit Kambil. Thank you very much. And thank all of you for joining, and stay safe, and we'll look forward to seeing you the next time. Thank you.
Thanks, John.